Hi everybody. Today we are going to discuss about the MCQs with detailed explanation for all medical examinations. Get started. First question. Which of the following symptom is a common in client with duodenal ulcer? Option A. Vomiting shortly after eating. Option B. Epigastric pain following meals. Option C. Frequent bouts of diarrhea. Option D. Presence of blood in the stool. The correct answer is option D, which is called as melena. Presence of blood in the stool is also known as melena, which is common in client with duodenal ulcers. Then option A and B, which is common in client with epigastric ulcers. This is the future of epigastric ulcer. Then this is not related to the ulcer. Then second question, which is the type of endotracheal tube is recommended by CDC for reducing the risk of VAP, ventilator associated pneumonia? Option A, uncuffed. Option B, CASS. Option C, fenestrated. Option D, Nasotracheal. The correct answer is B, which means continued aspiration of subglottic secretion. This is the endotracheal tube which has a suction port here. It continuously suctions the secretions which have been collected in the subglottic region. Okay, so this kind of endotracheal tube is recommended by the CDC for reducing the risk of VAP. Uncuffed means there is no cuff. This kind of cuff is absent in the uncuffed. This increases the incidence of VAP, so we should not use uncuffed. And fenestrated, which has a opening. It's a type of endotracheal tube which has a opening, that also increases the incidence of VAP. So this both increase the incidence of VAP. So this is contraindicated, not commonly used in the ventilator patients. Nasotracheal is not a endotracheal tube. It's a route for insertion of endotracheal tube, not tube. Okay, it's not tube. Then question number 3. When observing the respiration of a client, the respiratory cycle is marked by the period of apnea. Okay, that is lasting for 10 seconds to 1 minute. The apnea is followed by the respiration that gradually increases in the depth and frequency. This is what kind of respiration? Option A, Cheyne-Stokes respiration. Option B, Kushmail respiration. Option C, Biot respiration. Option D, diaphragmatic respiration. The correct answer is Cheyne-Stokes respiration. What is Cheyne-Stokes respiration? See, there is an increase in the rate and frequency of the respiration at the beginning, and there is a period of apnea which lasts for 10 seconds to 1 minute. Okay, then it is followed by increase in the depth and frequency of the respiration. If there is irregular respiration, which is called as a Cheyne-Stokes respiration, which can be seen in patient with traumatic brain injury, encephalitis. Then Kushmail respiration, which can be seen in patient with DKA, metabolic acidosis. Which is increase in rate and depth of respiration, that is Kushmail respiration. Biot respiration, which can be seen in patient with increased ICP. This is diaphragmatic respiration, it is wrong. Then, a client taking anticoagulation medication has developed a cardiac tamponade. Which finding is associated with the cardiac tamponade? Option A, a decrease in systolic blood pressure during inspiration. Option B, increase in diastolic blood pressure during expiration. Option C, increase in systolic blood pressure during inspiration. Option D, a decrease in diastolic blood pressure during expiration. The correct answer is option A. The term is called as, this is C. First there is expiration, there is a decrease in the inspiration, there is expiration. Systolic blood pressure decreases by 10 mmHg during the inspiration. The term is called as pulse paradox. Pulse paradox. It's a main feature of the cardiac tamponade. What is cardiac tamponade? It's a pericardial effusion. There is an accumulation of fluid between the visceral and parietal pericardium of the heart. So the pulse paradox is a main feature of the cardiac tamponade. Okay, decrease in the systolic blood pressure during the inspiration. Then moving on to fifth question. What is the expected feature of Brown Sequard spinal cord injury? Option A, total loss of motor, sensory and reflex activity. Option B, incomplete loss of motor function. Option C, loss of sensory function with potential for recovery. Option D, loss of sensation on the opposite side of the injury. The correct answer is option D, loss of sensation on the side of opposite to the injury. Okay, this is Brown Sequard spinal cord injury. This is the area of the cord damage. On the affected area, there is a loss of motor function. Okay, on the opposite side is a loss of pain, temperature, and light touch on the opposite side. So loss of motor function on affected side, loss of sensation on opposite side, on affected side. Okay, on affected side. On the opposite side there is a loss of sensation. This is Brown Sequard spinal cord injury. Thank you for watching.